Hi, I'm Dr. Richard Jermyn, and I'm the Interim Dean of Rowan-Virtua School of Osteopathic Medicine. I'd like to welcome you to the videocast series where I'll be highlighting various thought leaders that contribute to the mission of moving our medical school forward. Today I invite Dr. Joshua Coren. Dr. Coren is the Senior Associate Dean of Clinical Affairs, the Professor of the Department of Family Medicine, and Director of Continuing Medical Education at Rowan-Virtua School of Osteopathic Medicine. Dr. Coren attended Philadelphia College of Osteopathic Medicine and completed the Family Medicine residency at UMDNJ School of Osteopathic Medicine. He has secured over $7 million in federal, state, and foundational extramural funding. He's also an international lecturer and physician trainer for countries developing and enhancing primary care physicians and their healthcare workforce. He's fellow of the ACOFP, receiving the title the 2022 Educator of the Year, and in 2023, he also received the title of Physician of the Year. He's also a proud father of 4 children, which he numbers 1, 2, 3, and 4, and proud husband of an osteopathic pediatrician, entrepreneur, and leader. So it's my great pleasure to introduce to you today Dr. Josh Coren. Welcome, Dr. Coren.
Thanks, Dean Jermyn. Great to see you.
And Josh is good?
And Rich is good.
Very good. Awesome. So first question, you're our clinical dean, and we have something unique here. It's called a faculty practice. And why is that important to have, and what makes it unique for a medical school?
Rich, we're lucky. We are a DO school that is unique in that we have clinical, academic, and research arms that all come together. Our faculty have a faculty practice plan that operates underneath the medical school. It operates for New Jersey, and we're here to educate students and provide health care for the region. What's great about it is our students get a chance to see in action the physicians that they get taught from in clinical practice. It's the playground that they're going to get educated in. They see us as faculty teaching and then also caring for patients. We're following the mission directly within that educational clinical arm.
So as you talk about mission, we're going to talk a little bit about growth, right? So we can't grow the medical school without growing the plan. Sure. So what are some of the things that you're thinking about as we are growing and developing?
So we have the lifespan of care from pediatrics and obstetrics out to geriatrics, and we have some of the best institutes that have developed within the region and really from the country standpoint. We have the Neuromuscular Institute, which you are the founder of. Kudos to you on that. New Jersey Institute for Successful Aging. We have the CARES Institute, which is the Child Abuse Research and Education Services. And we also have our newest, which is our Regional Integrated Special Needs Institute. We just changed it from Rowan Integrated Special Needs pretty recently. All of these function in the faculty practice plan to serve the needs of the population. The best part about it is our students get to see us taking care of patients without any consideration about economic status. We go to their residence, we'll go to their facilities, we'll actually go to them if they're even without a residence to provide care. And then they come to us, of course, within our homes here, within the multi-county areas, to provide clinical services. But in this great playground of sorts, we're showing our students, our residents, and all of New Jersey the great professionals we have for both the clinical practice and the education.
So staying on mission, you said something a couple seconds ago that I want to highlight. We're very, very proud of our mission to treat the underserved.
Yeah.
And so I'm throwing back at you, what are we doing in the very near future that will get us even more into the communities that our mission is telling us we should be?
Many of our departments, and this is where the research arm comes in, are exceptional about getting grants. We are not in just small foundational grants. We have foundational, state, and even federal grants, including HRSA. We have now 6 federal grants in HRSA that are focused on training and educating our students, our community, our providers in how to provide care in underserved regions, how to give back to the community, care that's needed for patients with limited English proficiency, care for patients with special needs, care for patients suffering from the epidemic of addiction. And again, you've been involved in many of those grants, as well as all the SAMHSA grants too. These are all federal grants that our faculty are doing. I go around to the various organizations and people are just wondering, how do we do this, with our faculty? And the reason is we have a deep team that are integrated in the clinical, research, and academic arms. And they're focused on the mission, which is caring for the underserved. So when we put these grants together, it's focusing on how do we make sure we do better for the people out there in the community.
I'm going to kind of circle back in a little different way. You've been a leader here for many years. You're now Senior Associate Dean. Congratulations on that. But why did you get into academic medicine?
Yeah, I love this intersection of medicine, teaching, and even the healthcare business model. But the teaching part, I come from two teachers. My mom's a teacher that became a psychologist. My dad was a serial entrepreneur in a lot of different types of areas, became a special ed teacher. And I've always liked teaching and talking to people. And I found that we are here to create the next generation of learners that becomes physicians. I always adored my mentors growing into my medical education. I wanted to be that same impactor for students, residents, and faculty. See them develop, see them flourish, see them have their wins. And that environment is such a fun, different environment than I think I could see in any other healthcare field right now. When you're within our facility, innovation is part of what we do. And you take the credit for the wins, and our goal is to try to help support that. So I always like that environment.
Have you spent most of your career here at Rowan?
Every day, yeah. So I could say to you that from residency forward, I've been here, and I've gotten a chance to see the university and the school change, as you have as well, but change really for the better in so many ways. See it flourish with research, see it grow in academics, grow in deeper benches of academics, faculty, offerings, curriculum, clinical services. I've really gotten a chance to watch through 2 decades. Since 2002, I've been here, watching this school transition. And I'm excited to see what's going to happen next.
What advice would you give to students, trainees, about taking a leadership path?
I can give you a great example, Rich. I went to our students when we decided to put, as a school, a COVID vaccine clinic together. And with our students, we had a chance, and I got a chance to watch them in their leadership and innovative capacity take an idea, which was to offer a vaccine to our community. When everybody was watching this virus go through the community without really any idea of how to control it, and offer their services to open up a vaccine clinic in our school, in this building right here that we're in today, for anyone in the community to come in. Without our students, we would not have been able to open this up. And we ended up vaccinating 60,000 people because our student leaders and our student volunteers recruited interprofessional teams, volunteers, every day serving the community, injecting, typing in information into the system for patients, translating in different languages. But what was fascinating, and the advice I'd give to students, is you could do amazing things, and we're here ready for you for your innovative ideas. I would tell students right now, bring them, because it's going to make us better. And that was a great example of how we stood out, not just in the city or the state, but in the nation. We were doing it December 24 of 2020, whereas everybody else was trying to figure out how to get themselves into a vaccine clinic anywhere. We were already doing it before the large mega centers opened up. Yep. And they were coming to us to ask us how we did it. And I said, it's because of our student leaders and our students and our supportive faculty and staff.
And if that wasn't enough, we had to go out into the community in vans and tents and do the same thing. So it didn't end.
You carried that forward very well.
Well, it was definitely, to your point, we did this together. Having said that, though, getting back to the clinical realm, there's a lot of talk, and my understanding is you're now the medical director of a soon to roll out physician assistance program.
Absolutely.
So congratulations on that.
Thank you. Thanks. Yeah.
And why is this important?
Rich, we're in a state that's got an aging population with an aging workforce that already has a workforce gap, and we are doing our best at multiple levels with medical school, with our nurse practitioner program. We then looked at the vehicle and needs of the state, and the state needs more healthcare providers, period. Physician's assistants become part of that vehicle to provide care in different settings with the partnership of physicians. And I think that we, as experts in what we do, really are the right partners to really help that along. We can't wait for how this baby boomer population is going to get access to care. It's happening right now. If we don't start to serve the needs, the gap is going to start to actually break the system. So our goal by training DO students, APNs, PA students, and many, many other healthcare professions is really just to meet the needs for the state and the workforce that's aging out.
So if I hear you right, if we think about it from an educational perspective, this interdisciplinary thing that everyone talks about is really here and now, right? Like we have to train students that will eventually be team leaders. Is this?
We've been living it in the
Yeah.
institutes.
Exactly.
The institutes have probably had the art behind the success over the last decades. You can go into a one-stop shop setting of multiple different disciplines where they're taking care of patients. I think that this is one more adjunct to that. So if you've got now the physician's assistants working with these various professionals in an institute, in an office setting, in a hospital, in an ER, it's going to help our patients. That's what we have to focus on. Access to care, affordability, quality. Those are the three drivers of what we do.
Access of care. My understanding is you're developing a new program in Vineland. Do you want to tell us a little bit about that?
Yeah, so we've been fortunate. We are able to imprint on one of the counties with the worst healthcare outcomes in the state, and that's Cumberland County and really even Salem County as well. Out of the 21 counties, they really hit the lowest indicators. They're 20 or 21 for obesity, for diabetes, for cardiovascular disease, for smoking and addiction even.
Yep.
So now, why wouldn't we want to make that impact? Why wouldn't we want to take 21 and make it something better than that? We are going to build off of that. So our three departments, the Neuromuscular Institute, our CARES department, as well as our RISN department, they're all going to be opening up June 2024 into this region. Think about the services that are provided now into what effectively is a desert in South Jersey. What we're going to be able to do and help the community, and that student education and learning and the outcomes that we may be able to show in 5 or 10 years about where 21 maybe becomes 15 or 10. That's a really great impact. That's showing that we can take care of economic residents or no residents and then not discriminate against illness. We're going to try to help that out.
So this is really all about mission.
It is.
Letting mission guide the way, and finding a way to make it work, both financially as well as from an educational perspective. And I think it's really important that we always concentrate on the fact, that we recruit students, now soon-to-be PA students, as well as our medical students and our nursing students, and to understand that what guides us primarily is our mission.
I'd love our students to see this, become engaged in it, make it better with us, become residents in our partnership with Virtua in the system, and also in our partners within the region. And then join us as faculty. Join us within the South Jersey community, because we got a lot of good stuff that we're doing right now, and we could see how you're going to bring more ideas to help us even do the next 10 years that much better.
One last question.
Sure.
What makes you most proud?
I think seeing somebody do something that works for them. It doesn't matter what it is. It could be the student who said, I wanted to try this differential diagnosis treatment plan, and seeing that click of that worked, or seeing a resident successful with a poster project, or seeing a faculty get a promotion, seeing somebody get a grant. That feels great to me. And I think that that's one of the things that I always really liked about this place. You could see these different things throughout your career and in the various formats. Seeing a staff member go from entry to now they might become an administrator in one of our departments. I think that anybody that's seeing this can see that our system encourages people to grow. And I think that because it happens, and I've seen this really go forward, I'm a product of that. I started as a faculty member. Now thank you, working with you as a Senior Associate Dean for Clinical Affairs. I've gotten a chance to see that through many different leadership aspects. But I've gotten a chance to see that, to try and to fail, and then to try again and succeed. So I like that a lot, and I think that people who have developed careers here and stay have really gotten a chance to see that, and I think make it an enjoyable career. Not a job, but really a career.
Dr. Coren, thank you so much.
Thank you, Rich.
This was so fun, first of all. I knew it would be. And enlightening, and I think extremely informative, because you get the questions of what's next and why are we doing it, and I think you really answered it on all levels of our mission, so I want to thank you. I want to thank our audience for continuing to listen to our video cast series. Just keep in mind we will be releasing one every month, and I'll bring future leaders. Send me questions. I'd be happy to navigate them in some of our interviews in the future. So once again, thank you very much and have a great day. Bye.